The Disability in Pregnancy Study, Research Snapshot. Health Characteristics of Reproductive-Aged Autistic Women in Ontario, a population-based, cross-sectional study. The medical definition of autism is a neurodevelopmental condition that impacts how people communicate and interact with others, and how they experience their environment. Autism has historically been described as a mostly male condition due to the predominance of male-centered autism research. However, an increasing number of girls and women are being diagnosed with autism. Because of these factors, we know little about the health needs of reproductive-age autistic women. In this study, the researchers used health administrative data held at ICES to look at all Ontario women diagnosed with autism who were between 15 and 44 years of age in 2017. The health characteristics of autistic women and non-autistic women were described, including those related to socioeconomic characteristics, physical health, mental health, use of medications that could increase the risk of birth defects, history of experiencing assault, and consistency of care by the same family doctor. Autistic women experienced several health disparities. Autistic women had higher rates of chronic conditions like diabetes, mental illness, and using medications that could increase the risk of birth defects, and a history of experiencing assault compared to non-autistic women. They were also more likely than non-autistic women to be socioeconomically marginalized. What you need to know. Reproductive-age autistic women had poorer health outcomes compared to non-autistic women. It is important for health interventions to be tailored to the needs of autistic women. How can we use this research? The findings from this research highlight the needs to adapt health promotion programs and interventions to better meet the needs of autistic women. It is also important to raise the awareness of clinicians providing women's health care to the needs of their autistic patients. This study is led by researchers at the University of Toronto Scarborough and the Centre for Addiction and Mental Health, and is funded by the National Institute of Health and the Canadian Institutes of Health Research. We wish to give thanks to our advisory committee, which includes people with lived experience, service providers, and policymakers. For more information about this research, check out the link below.